तुम्हारा ये वाला ये काम हो गया। दिए सब
Uh, Thank you so much for joining the call. Dr. Mukat, very good evening. Can you please confirm if Dr. Dev has joined this call?
Hi, Dr. Madip. Good afternoon. Just allow me 1 minute, please. Please allow me 1 minute.
Dr. Mukat, I think I can see him in the call.
Dr. Amardeep.
Very good evening, Dr. Dev. So, very good evening to all the doctors and the senior official who has joined this call. Thank you so much for joining. And uh, this call is primarily scheduled to give you an brief about the CDSS, which is a clinical decision support system. One of the key initiative being taken place by the National Health Authority. And we have, let me introduce myself. I'm Dr. Amardeep Saroy. I'm along with my team member, Kenneth and Kritika. We all are leading the CDSS track from the National Health Authority. Along with, we have a tech team, a CDSS tech team, Dr. Dev. He's the CEO of the Clinali, Dr. Mukat, Tejas, and Mr. Bharat. So I would like to welcome you all on this very first training and a kind of workshop for the CDSS. Let me just give you a brief background. Is it for everybody or only for you, Samruddhi?
Dr. Amardeep, it's clear to us. It's clear to me.
Okay, there must be a
Okay.
network issue with my side. Okay.
Might be. So I hope I'm audible loud and clear to all.
Yes,
So
you're
let me just
visible.
give you a brief. Let me just give you a brief about the CDSS, then proceed with the presentation more. We have also planned on how the CDSS is running on the NIC platform. The third would be a QA session, where we will have the QA session, we'll have all the queries and we'll try to address all the queries within this call. So CDSS is one of the initiative that the National Health Authority has taken up. The National Health Authority is always looking up for supporting innovative tool. We have one innovative tool such as a clinical decision support system, which has been developed by the AIMS team. They have done the research in the past the past time in the South Asia for over the decade, and they have come up with over down the micro and the microvascular diseases, which is associated with the diabetes, hypertension, and dyslipidemia. So this CDS is primarily based on three diseases. One is a diabetes, which is abnormal blood sugar. Hypertension is abnormal blood pressure, and dyslipidemia is abnormal cholesterol can be associated with any of the disease, if it is a diabetes or a hypertension. It is currently being integrated with the NIC, and for the CDAC, it is integrated with CDAC Isushrutlite. We have couple of private players also, and till date, we have 2.17 lakhs of transactions. Transaction is by the recommendation that we are getting from the CDSS platform. We are getting a very good response from all the partners, specifically from the NIC and some of the private partners. They are using it and they are getting a benefit of those CDSS platform. We would be highlighting all the benefits on the presentation mode. We have the tech team with us. We have Dr. Dev and his team. Dr. Dev, I just wanted you to take
Dr.
this up.
Amardeep, you are not audible in middle. I think there is some network issue from your end. I'm not sure whether others can listen to you clearly.
For
Yeah,
the
we also lost some part of the conversation.
Administration of the recommendation. Am I audible now? Or
You're
Doctor,
audible in
I'm
pieces and
audible.
it's in pieces.
Okay.
Please go ahead,
So I
Dr.
just
Amadi.
wanted to. Okay, I just wanted to repeat this again. So there would be, so our presentation would cover into a pieces. The first part, I just given you a brief what is CDSS and how we have integrated with the NIC platform and also with the other partners. Along with that, uh, there is a presentation mode that Dr. Dev and his team would be covering off, and followed by a small demonstration that would cover how the CDSS will work, how we can get the recommendation, how the vitals is getting entered into the system, and then we will cover the QA session. If anybody, if any respected doctors and the officials is having any query regarding that, we would try to cover and address all the issues. Dr. Dev, over to you. Thank you.
Thank you, Dr. Hamadi. So we'll start with the presentation. We'll give an overview about clinical decision support system, the work that we have done, and then we'll proceed with the demonstration. Dr. Mukat, can you
Sure,
start
sir.
with that? Yeah.
Dr. Amardeep, I've just requested the screen sharing rights. Can you please allow me?
Just give me a minute.
Yeah, now I have the right.
Thank you.
Is my screen visible to everyone?
Yes, Dr. Bhagat.
So this is the small training session that we are having for clinical decision support system. We'll cover the following topics. We'll talk about what is clinical decision support system, or we call it CDSS, why the CDSS is needed, and the kind of research which has gone behind developing CDSS and the impact it creates. Then we'll talk about the benefits of CDSS. And last, we'll discuss the workflow. So CDSS is nothing but a computer-based program to help doctors to analyze their data in the EHR records against the domain knowledge and the established evidence-based guidelines.
Can we request everyone to mute their computers? So yeah, thank you. Dr. Mukat, please go ahead.
Yeah, so I'll talk about the advantages of implementing CDSS. First of all, it improves the overall efficiency, then reduces errors and adverse events, and enhance overall quality and availability of care. And this has been considered as a best practice by CDC USA.
So, Dr. Mukat, yeah, I want to add something here.
Sure, sir, please go ahead.
So CDSS is a software which is now part of many front-end platforms that you are already using. For example, NIC platform, if you're using it. So it's not a new software where a doctor or a nurse or anyone in the clinic, they have to enter any additional data. So whatever data you're already capturing, CDSS will work on that data in the backend. And the reason why NHA is supporting clinical decision support system is because this technology is designed to assist our doctors. So probably you can say it's a virtual assistant for the doctors. It helps the doctor in viewing the patient profile, and also it tells the doctor what are the recommendations, medicine recommendations based on the guidelines. Because doctors, they are always busy with so many tasks. So it is just to help them, support them so that they can provide the evidence-based care to their patients. So the recommendations that comes to the screen, they're very easy to read and understand. So these are not articles. It will just tell what medication should be given, what are the contraindications and all. And CDSS is a technology which has been proven to be effective, useful for all level of care around the world. So one of the example that we have given here is CDC USA. So in fact, in US, UK, in other countries as well, CDSS is being used in the routine clinical practice. Dr. Mogit, please, next slide.
So now we'll talk about why we chose CDSS and why CDSS for hypertension and diabetes. So in this slide, you can see first ever decision support system for managing hypertension and diabetes in India. It has been jointly developed by All India Institute of Medical Sciences, New Delhi, and Center for Chronic Disease Control.
Request everybody to kindly mute your system. We are not able to hear anything on the presentation. Mr.
I
Vivek,
think-
sir,
Yeah.
if you can mute yourself, GMC Katua, Mr. Vivek, if you could, Prandeep, if you could mute yourself. The presentation is going on. Yeah, Dr. Mugat, please go ahead.
So now we are talking about why diabetes and hypertension to begin with. For the first time ever, WHO member states have supported the creation of global targets for diabetes. And the 5 new targets for diabetes by 2030 are 80% of the people living with diabetes are diagnosed. And out of this 80%, 80% have good glycemic control. 80% of the people with diagnosed diabetes have good control of blood pressure. 60% of people with diabetes over 40 or receive statins, and 100% of the people with diabetes type 1 have access to affordable insulin and self-monitoring blood glucose levels. Dev sir, if you'd like to.
Yeah. So even in India, like if you look at the prevalence of diabetes in 1990s and 2016, now obviously we are in 2025, the situation is worst. So most of the states, they were having diabetes prevalence around 5 to 6% in 90s. But if you look at the graph on the right hand side, the prevalence of diabetes has gone up in almost every state. So even if you look at, because few of the doctors are from Tripura here as well. So even in Tripura, the 2016 data shows that there is a prevalence of around 8% of the diabetes. Now the prevalence has gone up for sure. Next slide. Similarly, we know that in India, we have kind of epidemic of hypertension as well. 1 in 3 adults in India has hypertension. And the sad part about both hypertension and diabetes are there is already proven clinical management plan available for hypertension and diabetes, but still we are not able to achieve control for both the conditions. And if we look at the stats, what it says, out of 100, only 25% people are aware that they have hypertension. So it means that we need to put efforts on screening. Then people who are aware, only 25% get treated. So out of 100 who are aware that they have hypertension, only 25% goes to the clinics to get the treatment. So it means we need to motivate our patients to get the treatment. And then people who are getting the treatment, only 10% achieve the ideal blood pressure control. So we need to do a lot of efforts in providing the proper treatment plan to these patients. Next slide. So these are the reasons why AIMS, New Delhi, and CCDC, they decided to go for the CDSS for hypertension and diabetes. And in fact, NHA also spotted this particular initiative. So overall, if we look at the prevalence of hypertension and diabetes in India, we have more than 300 million people who are affected by these conditions. Next slide. But with clinical decision support system, we can build some of the gaps by promoting evidence-based treatment plan. Even during the introduction of clinical decision support system, we told that this particular software has been designed to help our doctors to assist them. It will act as a virtual assistant. It will guide them, help them in providing the proper treatment plan to their patients, and also telling the doctor what are the contraindications, what combination of medication works best, when to start statin. So everything will be there. Next slide. So when NHA and AIMS, since we are offering this solution to our doctors, to our health system, it is not something which is a new technology, and it is not something which we have designed recently. A lot of work has been done. Almost 15 years of work has been done on clinical decision support system. It started as a very small project in 2010. But if you look at this graph, you can see we worked on diabetes in 2010, then at the tertiary care level, then we worked in the community level, primary care level. We got the opportunity to implement clinical decision support system in the state of Tripura and Mizoram. Then it got part of the National Program for Non-Communicable Diseases. WHO has also adopted this clinical decision support system for hypertension, diabetes, COPD, asthma, cancer, alcohol, and tobacco. And now this clinical decision support system with a lot of changes and upgrades is being offered by National Health Authority. Next slide. So few slides were about the implementation, but also when our team, they did the study or research whether clinical decision support system is making any impact on the clinical outcomes or not. So we implemented CDSS in the government hospitals in Himachal Pradesh for almost 21 months. During that period, around 21,000 patients were screened and 6,800 patients were found to have hypertension and diabetes. And one of the important findings was out of 6,800 patients, 50% were not aware about their condition. So it means by implementing a simple technology, we were able to detect new patients. And this again reflects that even if we don't talk about the treatment, even for the screening part, even if we implement something very simple, it will help to our community, to our people, understanding that they have hypertension or diabetes, just in case if their parameters are not the way it should be. And if we look at the clinical outcomes, we were able to achieve significant reduction in their blood pressure and in their glucose level. And if you look at the graphs on the right-hand side, not only we were able to achieve the reduction, till the time these clinics, they were using clinical decision support system, that reductions were maintained. So it shows the continuous impact of using the technology, and this has been published to the one of the prestigious journal. Next slide. So previous slide was talking about when we implemented the clinical decision support system in the CSC kind of setup. Now, if you look at this particular slide, we implemented clinical decision support system in the tertiary care center where the specialized doctors were available. Even there, if you see, the doctors who rejected the prompts of CDSS as compared to the doctors who accepted the prompts of CDSS, for the rejection, the HbA1c, mean HbA1c was around 8.6, but for the acceptance where the CDSS prompts were accepted for the patient, their mean HbA1c was around 8. Similarly goes with the blood pressure, 144 compared to 123, LDL values around 90 compared to 128. So it clearly shows even if a doctor is a specialized doctor, having clinical decision support system is going to assist them in achieving better controls. Next slide. So these results have been published recently. Now, when we talk about hypertension, diabetes, or abnormal lipids, our end goal is not just to achieve a better blood pressure control or blood sugar control. We want these patients should not have any issues with their eye, kidney, or heart. So implementing clinical decision support system and doing the follow-up for around 6.5 years. So it is one of the very rare studies in the world where the follow-up happened for such a long period of time when we implemented clinical decision support system. Even there, what we have found is that the patients for whom the clinical decision support system was used, those patients had less number of microvascular events compared to the other side of the patients. So there is also long-term benefits of clinical decision support system. Yeah, next slide, please. Yeah, next. So we now, since we are offering clinical decision support system for two main conditions, diabetes and hypertension, from the doctor's point of view, there are like many doctors in this call today. So we want to tell you how CDSS works for diabetes. It gives the recommendations for oral hypoglycemic agents and insulin. Within OHA, depending on patient profile, sometimes it will recommend metformin, sometimes it might recommend sulfonylurea, but it will give you a cafeteria of choice. It will not just restrict you to one drug or two drugs. It will give you an example. Okay, you can go for this or you can go for that. It helps the doctor, it assists the doctor in titration of dose. So for example, if the patient is already taking some medication, but his or her blood sugar is not under control, CDSS helps the doctor in increasing the dose or adding a new class of drug or reducing the dose as well. It also helps in detecting the new cases, as we have shown in our previous studies as well. Also, it considers whether the patient has any comorbidities like kidney disease or heart disease or liver disease. So for example, if a patient comes to the clinic and the patient reports to the nurse that, okay, he has a medical history of heart disease, accordingly, CDSS will recommend the medication. It also identifies the patient with high risk where we need to start statins. It gives contraindication alerts. It provides recommendation on lifestyle advice. Now, one of the very common question that we have been asked most of the times, the ideal situation for treating any patient with diabetes is that we have their HbA1c value, we have their fasting value, we have their PP value. But we know that in clinics, sometimes these tests are not available. Sometimes patients cannot afford some of the tests. So even if we enter the random blood sugar value to the system, it will give recommendation. So it considers whatever test you give, whatever test values are available, and it will give the recommendation. And one important thing to note here is this clinical decision support system is for type 2 diabetes mellitus. It is not for type 1 diabetes mellitus and gestational diabetes. It is only for the type 2. Similarly, if we talk about hypertension, it tells or it gives recommendation or it helps in diagnosis of undiagnosed cases. Again, when we give the treatment for hypertension, it is very important that we look at the comorbidities, whether the patient has COPD, asthma, CKD, heart disease, so diabetes. So even we have seen in our literature and research findings, a lot of patients with hypertension will have diabetes or vice versa. So when the patient has hypertension and diabetes both, then we need to treat them accordingly. It also gives the recommendation for lipid and statins, and it consider the current treatment plan. So for example, if the patient is already taking ACE inhibitor or calcium channel blocker, it will consider those factors. So it is not like a flow chart. It is basically looking at all the parameters of the patient, and it provides the recommendation according to the patient profile. And it provides personalized lifestyle advices as well. In 2023, Government of India, they launched a new operational guidelines, and clinical decision support system has been included as one of the important intervention in the new guidelines for national program as well. Next slide. This is the WHO app who has adopted the clinical decision support system from our team, and it has been implemented in Maldives. Next slide. In fact, World Heart Federation also recently they published a roadmap for digital health in cardiology, and they have included the clinical decision support system developed by AIMS and CCDC as one of the case studies for showing one of the case studies a successful digital health intervention. Next slide. United Nations also selected the clinical decision support system. In fact, the picture that you're seeing on the screen is from one of the clinics in Tripura. So this technology has been, in fact, supported and endorsed by many organizations, including WHO, WHF, United Nations. I'm talking about the international organizations. In India, we know that NHA is also supporting it. So yeah, next slide. So the workflow is very simple. When a patient, for example, if a patient with diabetes comes to your clinic, a nurse or any of your assistant, they are supposed to do the initial assessment or registration. They register the patient, they check their height, weight, ask them few basic questions, enter the parameters into the software, and CDSS, without looking at the patient identifiers, only requires patient clinical parameters. It analyzes the data in the backend, real time. It doesn't take any time in giving the recommendation, and it gives the recommendation back to the doctor. Doctor looks at the CDSS recommendation. It hardly takes 30 seconds to look at these recommendations, and then the doctor, they can prescribe whatever drug they want to prescribe to their patient. So this is it from the presentation. If you have any questions, please feel free to ask us.
Thank you, Dr. Dev. Dr. Dev, I think we can go ahead with the demonstration mode. Then we can take all the queries based on the presentation and the demonstration. So, respected all the doctors and the participant, I think the next part for this training session would be a demonstration. We'll give you a demo how the CDSS will work, how will you get the recommendation from the platform. So primarily we are using the NIC platform. We will try to give you the live demo. If it is not working, then we will run a video of that. So this will give you a better idea how, as a doctor, you can use in the clinics, how you can use the CDSS module, which is already being embedded in HMIS. So how you can use the CDSS and how you will get all the prompt and getting reflected on prescription part. Dr. Mukhat, we are not able to hear you.
Yeah, I was not speaking. I thought you were speaking. So I'll start with the patient registration here.
Okay.
So this is a platform for NIC. I'll quickly do one dummy registration here. This patient age is 46 years. So we have done the registration part. So this is the last patient that we just registered. Now here we are on the initial assessment screen. For the examination, I'm randomly adding some height. Body weight I'll take as 86 kgs. Now I'm entering the high values for the blood pressure. I'll save the parameters. It says my data has been saved.
Dr. Mukesh, shall we add random blood sugar as well?
We can do that, sir.
Yeah.
I think I'll have to re-register a patient because I've saved the details.
Okay.
Shall I go ahead currently with this right now?
Yeah, please.
Now I'll go to the diagnosis. It says fetch the CDSS recommendation. I'll click here. Now, since I added no values for blood sugar, CDSS recommendations are patient does not have diabetes, but has hypertension. Now, this is the medication part. Here again, we have a tab which says CDSS recommendation. So here I got the recommendation saying the patient has hypertension, stage 2. The recommended action is pharmacological treatment, and it is giving me a drug recommendation. Basically, CDSS is suggesting I can choose any one of the 3 options. Option 1, option 2, and option 3.
So doctor can prescribe whatever drug is available in their clinic, and based on the medical history, what is their current blood pressure, it gives the recommendation. If the blood pressure would have been normal, it would have said patient doesn't have hypertension. Now the blood pressure is high. If there is a hypertension emergency, or if there is a medical history, accordingly it will recommend the different medication. But in this particular case, there are 3 options doctor can give, and within one option, doctor can decide any drug that they want to give.
So this is as simple as, it hardly took me a minute to prescribe a drug using the CDSS platform.
Dr. Mukul, just wanted to add one thing for all the audience. We have whatever the recommendation that we are showing up through the CDSS, these are the basic drugs. These are in that need to be present in your HMI. So whenever you are whenever you are using you using CDSS and getting recommendation, you don't need to be worried about if those drugs are present in the HMIs or not. So these drugs must be present in your HMI. So these are the part of the basic inventory and the basic master list of all the drugs. So this will be present. So these are the very minimal drugs. We have not kept the brand names. These are the basic, the generic name of the drug, which is present, available, and getting prescribed by the CDSS. So you don't have to be worried if whatever the recommendation we are getting, if those drugs will be present in the master list in the inventory or not, that will be present. So we have covered, we have given you the brief overview, what is CDSS, how you can use the CDSS, what was the benefit that will be getting by the doctors. So I think we need to we are giving a platform to the audience. You are feel free to raise any query, any questions. We'll try to address within this call. Thank you. I'm also writing down the email. If you have any further query, you can write it down to us. So anybody wants any clarification over the path over the usage of the CDSS? So this feature is already being present, already being integrated with the NIC platform. We have done the tech part, we have done the integration part. We are only urging you to use that feature, but before using any feature which is it might or might not be present in HMIs, you must be aware of what kind of benefit the doctor may have, what kind of benefit the patient may have. So this is the feature which is already being present. The only thing you need to start it, you need to get benefit from the CDSS kind of
Hello.
assistive tool for you. Yeah,
Hello.
please go ahead.
Actually, in the demonstration, it's shown that some of the facilities are using the CDSS in Tripura. So I just want to know that in which portal they are using.
Sir, actually in Tripura, there was one initiative done by Government of Tripura from 2017 till 2020. It was NCD Initiative Tripura.
Okay.
And during that point of time, clinical decision support system was implemented in all the 8 districts.
Okay.
But after that, since the COVID happened, and then there was a national program for NCD, and the NP-NCD portal also came into the picture. So CDSS was done directly integrated into the into the NP-NCD portal. But now through NHA, it is being available to all the platforms, not just the NP-NCD platform. It is available in the e-Sashutru and NIC platform. So all the platforms, next gen platforms, all the platforms, they have clinical decision support system.
Okay. Is there any of the government portal is available?
So
Government
next
portal.
gen,
No, these are the next gen issues. To these are all the HMIs. Okay.
Yeah.
My question is that is the CDSS is available in any of the government program like NCD, Niksha, any of the program?
so sir, NP-NCD program also has clinical decision support system. And in one of the slide, we also showed the guidelines document. So you have to request NHSRC to provide you the CDSS enabled version.
Okay.
So if you send a request to NHSRC that you want to use the CDSS in your NP-NCD portal, they will give you the access to the CDSS version. So there are 2 versions of NP-NCD portal. One is with CDSS and one is without CDSS.
Okay. Okay.
And
Thank you.
it's available. It's free of cost. There is nothing nothing required from the state side. Only just one letter has to go. One request has to go. That's it.
Okay. Fine. Thank you.
So any suggestion from the audience, this need to be done, or this, if you find any difficulty over the demonstration or in the presentation board? Yeah. Anything, if anybody wants to highlight, yes, please. Go ahead, sir. Okay. Any other participant, any hospital, particular hospital? I think I can see there are certain hospital have joined who are not using the next gen solution. The reason why we have invited you because we are planning to integrate with the CDAC. We have integrated with CDAC Issue Lite, which is a lighter version of the HMIS. Particularly, it is being using in microsite. So the reason why we have initiated this training session, so you can also raise a request to the CDAC so that they can also initiate the integration process with the CDSS. If you find it well, if you find it benefit for your hospital doctors as an initiative, plus AIMS product, which is being using by uh, uh, the other partners and supporting by the National Health Authority, can also be integrated with the CDAC platform. So the hospitals and the partners who has joined this call for today, they can also raise a request to the CDAC. And once the request being raised, definitely they will come and they will start the integration with us. We have also requested the integration things. I think sooner we will be able to onboard the CDAC very soon. Mr. VK, sir, I think you were supposed you're trying to ask something on the CDSS part. I think you want to raise some suggestion or something which we have covered on our presentation today. If you are still on the call. Mr. VK, no problem. Is there any other hospital or participant wants to raise or wanted to ask something about this CDSS? Dr. Dev, any additional thing you wanted to highlight over the CDSS? Yes, sir, we will share this PPT with you very soon.
Nothing from my side, Dr. Madip.
Okay. Sir, I guess this is for the Tripura. We will share with all the partners. We will try to share this presentation on the group as well, on the WhatsApp group, so that everybody will have the access. I think we have covered everything. So tomorrow also we will have the similar kind of training with the other zone. Anybody can join this call. Particularly, we have planned it for the west, east, and the northern region. So I think the agenda is very much clear for all the audience, for all the respected doctors and all the JDs, that we want. This is already a proven solution. We have worked around for the 15 years around the globe for the CDSS, and we want the doctor to use this solution as this already being present in the HMIS. If you need any kind of support, any technical support, functional support, do write us, do reach out to us from the NHA and from the CDSS tech team. We always be available for any solution for you. Start using it. And if you're facing any kind of issues with the CDSS platform or a CDSS module, raise it to us. So we are considering as nobody's having any further query, and we just need to share the presentation with you all. Tomorrow also we will have the similar kind of training and the workshop with the 3 other region. If anybody who already present in today's workshop, if they want to be for tomorrow as well, they can come and they can join the call. So thank you so much. We are also thinking of this is the model health facility training. We are also planning the state training in the I think we will start from the next week onwards. So we will invite all the states, particularly the doctors and the hospitals administration, to get the overview and the understanding of the CDSS. Thank you so much, and hoping to get on board very soon. Thank you, Dr. Dev, for giving us a very good brief along with the insight of the CDSS. Thank you so much, all the doctors, all the hospital donors, everybody to join this call. Thank you so much.
Thank you, everyone.
Thank you.